What do you do when you're faced with crippling indecision?
You would ask someone for advice.
Well, what do you do if you do that with every decision that you have to make?
Well, then you may be experiencing a dependency personality disorder.
Someone with a dependency disorder lacks initiative and is often incredibly insecure.
They are often worried about other people abandoning them and will do anything to prevent it.
Some symptoms of a dependency disorder include, but aren't limited to, a difficulty in making everyday decisions without constantly seeking advice.
Or an inability to go against the group in fear of losing their support or approval.
Also, they will go to excessive lengths to obtain acceptance and support from a group, to the point of volunteering to do unpleasant tests that nobody else would do.
Someone with DPD is also terrified at the thought of not having anyone to take care of them, and the thought of independence is also frightening.
As a disorder, the personality type first appeared in a War Department Technical Bulletin in 1945, and later in the first edition of the Diagnostic and Statistical Manual in 1952, as a subtype of passive-aggressive personality disorder.
Treatment is limited due to varied case descriptions and uncontrolled studies. However, there is a consensus that improvements are usually seen only with long-term therapy.
Cognitive behavior therapy and interpersonal therapy are believed to be partially effective. Antidepressant medication may also help treat the anxiety and depression that often accompanies this disorder.
People with dependent personality disorder can function reasonably well in society without therapy. Most people with dependent personality disorder don't see a doctor about it until they start having depression-like symptoms.
With psychotherapy or counseling, many people with DPD can learn how to make more independent choices in their lives. However, only a few actually achieve a normal level of independence.
This is how a normal therapy session for DPD would go. Who was your problem?
My boyfriend.
What did he or she do?
I just found out he's sleeping with my best girlfriend.
How did you respond to that event?
I felt so angry at both of them. I couldn't stand for this, but I couldn't walk out on my boyfriend, so I don't know what to do.
Did your response help?
No, I'm paralyzed. I don't want to lose either my girlfriend or my boyfriend. But my doing nothing about this is making me sick.
What did you do that could have triggered this problem?
This isn't the first time that my boyfriend has cheated on me, but I never do anything about it.
What life skills do you have to work on?
I want to work on independence and assertiveness.
Chronic physical illness and separation anxiety disorder in childhood or adolescence predisposes an individual to develop dependency personality disorder.
Research has shown that genetic, environmental, and prenatal factors all play important roles in the development of personality disorder. Some researchers believe that having authoritarian-type parents can lead to DPD also.
Dependent personality disorder is more frequent in females. Different sources differ on what percentage of the population has DPD. One source said 0.5%, another said 0.6%, and one said 2.5% of the population had it.
Dependent personality disorder isn't diagnosed with children or teens because of their dependence on others due to their age and developmental limitations. Personality disorders are slightly less common in blacks and whites. Also, whites, Hispanics, and Asians tend to show equal prevalences of DPD.
Some complications that can occur from DPD can include depression and a predisposition to be a victim of physical, emotional, and sexual abuse.
Sufferers from DPD also tend to have higher rates of drug and alcohol abuse.
What do these three people have in common?
Well, David Beckham, Bobby Fischer, and Stephen Colbert all have dependent personality disorder.
And that's the end of the lesson on dependent personality disorder.
Thanks for watching. Stay trippy, Manzu.